So, Dr. Lisa, I'm beyond thrilled that you're spending this time with me today. Thank you, thank you, thank you. I wish only that we were in person for so many reasons. So, you sit on the Founders Council for the United States of Care, and I'm super lucky that I get to sit on their Entrepreneurs Council. Um,
Likewise.
and both you and I share a deep and abiding love and respect for what they're doing. So, shout out to the US of Care. For those who don't know, and for quick context, the United States of Care is a nonpartisan, nonprofit organization that's working to make sure every single American has access to quality, affordable healthcare, regardless of health status, social need, or income. And if there was ever a moment in time where we needed that, it is right now. So if their mission mattered to us 3 weeks ago, 4 weeks ago, oof, I like to tattoo everything US of Care all over me right now. So on Tuesday, the extraordinary team at the United States of Care hosted a telebriefing for Capitol Hill and healthcare stakeholders as part of their continued response to the COVID-19 pandemic. And you were one of the speakers and you crushed it. And the second it was over, I called you back immediately. I was like, oh my gosh, everything you just said needs to be heard by everybody. So can we do it again? And I'll do this as part of Archangels. We'll just call you back. We'll get permission from the United States of Care to do it, but we'll call you back. And then I want to record it so people can see sort of the warmth and authenticity that comes off of you because you've been doing this for a long time. And just for context, so that everybody knows, you are a CDC-trained medical epidemiologist, you are a board-certified infectious disease physician, and you are a founder of Grapevine Health. And the perspective that you're sharing today, are you sharing it because you're sitting in a fancy office and you spend all your time in a wood-paneled conference room, or where are you sharing that perspective from?
Now I'm sharing it from the community because I've been on the ground with people talking to them about their challenges. And I have a video series called Dr. Lisa on the Street. So I like to get in the mix and understand what's on people's minds.
And just so those folks who need to check the box are also legit, super legit, and they may hope they go Google you later and read everything about you. Very quickly, before you hit the streets about 10 years ago, what were you doing?
I was an epidemiologist at the CDC in Atlanta. I was running a global AIDS program in the Caribbean. I've had a fabulous career, but being on the ground is one of the richest, most insightful things I've done.
So let's talk about you being on the ground as it relates to COVID-19. So you were on this telebriefing. Why? What was it that you wanted at a high level to get across?
I wanted to ensure the voices of underserved populations was in the room because when sensational things like this pandemic happen a lot of times the voiceless aren't considered, and so I wanted to share my perspectives and the lessons I've learned from people on the ground who are struggling day to day, people who may be homeless, people who are hourly wage employees who are concerned about their livelihood because of the financial impacts of this. I wanted to make sure that people who are listening, people in positions of authority, and who are defining and writing policy, understood the challenges of this population.
Of the underserved community, which is
Yeah.
great because as you and I both know, we're in, we often, there is no seat at the table for that population. And I'm so glad you're doing that. And I'm so glad the United Care is doing that. So you talked about misinformation. And usually you said related to things that may feel obvious, I'm quoting you, to clinically minded or trained folks or people in healthcare, because a lot of that stuff covered, let's say right now by the CDC. If somebody who is in traditional positions in the healthcare system goes out to search for information right now, they know where to go, they know how to process that information. But as you reminded us, very few people are going there, real people out in the wild, and if they are, they can get easily found. So can you share with us, when you were out in the streets right now, what are the questions that you're getting from people? What are the questions that folks are misinformed about and wish that they had answers to?
Mhm. You might be surprised to find that a lot of these questions are very basic. They're the things that you're hearing about in the media. So, how do I know if I have COVID, or what are the symptoms of COVID? Should I get a test? How is it transmitted? So, a lot of the questions that people who are watching CNN, reading CDC, reading NIH documents or websites, they would know these things because they are plugged in. But this population has been asking me these questions day after day. So the word's not getting out. It's not getting to the folks on the ground.
Yeah, not in a way that they can process. You also talked a lot about people wondering if they should get tested. Should they? Who should?
I understand the confusion around whether or not someone should get tested, because when this all started, because we didn't have enough tests, we told people not to get tested unless they had symptoms and they needed to be seen by a healthcare provider. But then lo and behold, we saw famous people like athletes and diplomats talking about their test, their coronavirus test, but they didn't have symptoms. So it seemed like a double standard, and people were asking, well, should I get tested or not? Like, which one is it? So there is a lot of confusion about that.
There was another thing you mentioned that was surprising to me, that you hear a lot of skepticism about the novelty of the virus. And the specific example you gave that I can't stop thinking about is the Lysol can. Can you share that quickly?
Sure. At baseline, there's a lot of distrust in underserved communities for healthcare and politicians, big organizations. But this question about whether or not coronavirus is new came up because someone showed me a Lysol can. And if you look on the back of any Lysol can, it lists the viruses that can be killed by Lysol. And it lists coronavirus. So the question was, if this is such a new virus, why is it on the Lysol can? Lysol's been around forever. So also it can be, I mean, it's understandable that this information is confusing to people. So helping them understand this is a new strain or a new species that used to be in animals, and now it's the first time we're seeing it in humans. I don't know if they all believe it, but you do the best you can to try and help them understand.
Well, you talked also about the misinformation about a cure or a vaccine, and specifically the question of, will a flu vaccine treat this?
Yes, because this is technical science. And when we administer medications or healthcare to people, we often don't take the time to explain what we're doing, to explain the rationale behind it, the why. And for a lot of people, when you say vaccine, that's the only thing that comes to mind, because that's what everyone's so accustomed to. Get your flu shot, get your flu shot. So they don't understand the nuances of what's in a vaccine and what makes them different. So none of that really surprises me. It's just that it shows what a poor job we're doing with improving health literacy and speaking so that people can connect with what we're saying.
Well, and I think a lot about teaching moments. It's like, when is the moment that we could connect, and when could we gain legitimacy as a trusted voice? And by addressing things, why I hope so many people hear what you're saying and take it back to their organizations is, when you're designing materials that are going to go out to the population at large, think about what Dr. Lee said, what you're saying, because people are processing information not from a healthcare background, and not only not from a healthcare background, but from a background that's informed by the folks with whom they're interacting. And these are the sort of questions people are asking. So these are the sorts of questions that we should be sure we're getting information out there on. One of the things you shared, I also can't stop thinking about, is a woman who said to you, this neighborhood is a lot more dangerous than coronavirus.
Yes. Yeah, so that's very humbling to hear that. When I moved into my neighborhood, that was one of the things I first noticed, was that people are distracted by trauma. There's trauma all around them, and it's not just gunfire. It's lack of access, it's scarcity, it's not having enough grocery stores. It's all these social issues that are compounding to make life very challenging for people, and that's traumatic. So if you live in an environment like that day after day, and something comes along, a virus, you can't see it, no one around you has it, you can't make the connection. It doesn't rise to the level of priority as, oh my goodness, I just lost my job because of this invisible thing, or how am I going to feed my family now? So those are the things that are on people's minds rather than this infection.
Yeah, which is mind-boggling to the folks who have invested, who have switched everything to be focused on this. And
Yes.
probably explanation for why spread isn't being minimized as quickly as possible, because folks are worried about these other things, like their safety and
Mhm.
security and their food and their families. So what is it? What can we do to help? I think one of the things that's hard for a lot of people is we're stuck at home. We feel helpless and we feel this enormous, need to do something. What
Yeah.
can people be doing to help?
Well, I think everyone can conduct some outreach, whether it's from the phone or the computer, to the organizations that are on the ground that are still every day doing this work. I spoke to 3 organizations yesterday who are in the social service space, and they're all their staff is still all out in the field, and basically they're putting their lives on the line as well, because someone has to be on the front line for folks when it comes to these social services around food um, and security. So I think calling these organizations to say, do you need help? What can I do? Maybe I can't come out and be on the front line with you, but do you need me to make phone calls? Do you need me to stuff envelopes? Do you need me to write documents? Do you need me to make a donation? Just asking, because I think we forget about this population, the underserved population, when they're not visible, when they're not being interviewed on CNN, when the headlines are about basketball players and famous people getting the virus. They're invisible,
Yeah.
and I think just being mindful that people are out there and they need help.
Yeah. So let's pretend we're on CNN and let's hope that everybody gets to see this. And there is a way to make this a channel, which is just for each of us to share this as much as we can. So as many people as possible get access to hearing you, because you've got such an extraordinary voice. You have such heart and such authenticity and such information that I think can help combat some of the misinformation and also just help people feel less alone, because one of the greatest worries I think for folks is that they don't know what to do. And there's, you hear one thing here and one thing there. So thank you. Can you tell people really quickly, where else can they where can we find more Dr. Lisa?
You can find Dr. Lisa on YouTube. We will resume making videos. We've already started making more videos because the need for good, trustworthy health information is really apparent right now, because there's a lot of misinformation. So you can find us on Grapevine Health on Instagram and Facebook at Grapevine Health. And then finally, we are launching a GoFundMe campaign to fight COVID misinformation. So if you go to the GoFundMe website and put in Grapevine Health, you can find us and donate to our cause, because we're all about helping people understand how to take care of themselves, whether it's a pandemic or not. So I want to thank you so much for this opportunity.
Yeah, thank you. And you can also go to find out more in general about United States of Care. Just go to usa.org, and folks can go to archangels.me, ARCHANGELS.me, and we will cross post and reference things over to you as well. Or at ArchangelsMe or at Adrane. Adrane. I can't even say my own name. Lisa, thank you. You're extraordinary. Thank you for everything that you're doing. We're super grateful.
And thank you. So nice to be here.